Great, thanks so much, Marina. Well, happy Earth Day and welcome to Hub's nonprofit risk management webinar hosted by Charity Village. As Marina mentioned, my name is Stephanie Dudley and I'm the VP of Small Business Strategy at Hub. I'm happy to be here today along with Hub risk management consultants Lilli, Chiu, and Monson, supporting nonprofit organizations by providing insights on how to navigate uncertainty and prepare for the unexpected. A little bit about myself. I've been in the insurance industry for the past 22 years. I have experience on both the company side as well as the broker side. Although I've held a variety of roles over the years, I have a sincere passion for the nonprofit sector and have spent the majority of my career building insurance programs for various groups and associations to provide comprehensive insurance solutions for their members. Lilli, over to you.
Thanks, Stephanie. Hello, everyone. My name is Lilli Chiu, and I'm an AVP Senior Risk Consultant working in our Risk Services Division at Hub International. I have nearly 20 years experience working in occupational health and safety consulting and commercial insurance risk management. Prior to joining Hub, I worked in the hospital sector as a health and safety specialist, and I have continued my career working in various positions as a risk control consultant for commercial insurance companies. I have a wide range of consulting experience in all sectors of business, helping organizations to identify and control workplace hazards and organizational exposures with a focus to reduce a company's total cost of risk. And now over to Isaac.
Thanks, Lilli. And I'm also an AVP and Senior Risk Consultant with Hub's Risk Services Division. And I'm specifically with the organizational resilience practice. And so we're supporting clients around topics like emergency action planning, crisis management, business continuity planning, and generally building resilience within their organizations. And so my professional background is first and foremost in law enforcement. I was with the state police for close to 10 years and then transitioned into safety engineering and corporate security roles. And I too have experience across most sectors. So that's how the three of us kind of play off of each other in this space, and hopefully our backgrounds will make more sense as we talk through the subject matter.
Thanks. Well, as we all know, nonprofit organizations continue to face a growing list of risks that have the potential to create significant disruption to operations, harm to brand and reputation, and financial loss. Whether it's property damage from a natural disaster or human-caused events like embezzlement, a proactive approach to managing risk can help reduce potential losses. Today's session will cover elements of a comprehensive strategy, including philosophy and approach, operating in the new normal, building a resilient organization, and the role insurance plays as part of your strategy. A little bit about Hub. Hub is a Canadian-born brokerage and one of the largest in North America. At our core, we're the same company we were 20 years ago, a team of passionate experts who go above and beyond for their partners and customers, with proven expertise creating and delivering insurance solutions for both individual businesses as well as groups and associations. We have experience across many industry segments within this space, and some of our targets include human service providers, religious organizations, foundations, charities, and education. As mentioned earlier, we specialize in solutions for groups and associations. A few of our key partners include the Ontario Nonprofit Network and the United Church of Canada. Our deep comprehension of the insurance industry, along with preferred carrier relationships, enable us to deliver unrivaled risk and insurance advice as well as solutions. Now, I thought a good place for us to start today would be to talk about some of the challenges that our clients are facing during these unprecedented times. Lilli, being on the front line and interacting with clients on a regular basis, what are some of the changes and challenges you're hearing from our clients?
Thanks, Stephanie. As we have all experienced this past year, the pandemic has drastically turned our lives upside down. We've experienced personal hardships and have also seen tragedy in the loss of lives due to the COVID-19 virus. What we've seen from our clients has been positive in how resilient they are with shifting their operations to adhere to public health guidelines. However, it has been a constant challenge for nonprofits with the evolving risk of disruption from the pandemic and at how it has impacted their people, property, and operations. Most organizations have never had to respond to this level of disruption before, and the approach they have taken is to protect their people, such as their employees, volunteers, and the community. Some nonprofits have had to terminate or temporarily lay off staff, and other nonprofits have been able to transition to a remote work setting. Nonprofits have been tasked with securing and managing their properties, such as offices, locations, and facilities during the pandemic. I've seen some organizations have had to vacate their offices due to lockdowns and essential and non-essential restrictions. The risk and exposure has been focused for nonprofits with monitoring the security and building maintenance of these locations during this time. There is a potential increased exposure to theft, trespassers, vandalism, and maintenance damage. Lastly, organizations are needing to focus on sustaining their operations, all while adhering to pandemic protocols in either a virtual or hybrid setting. I've seen this, and it has been a significant impact for nonprofits with struggling to make sure they are prepared with the necessary resources, technology, and innovation to adapt their regular in-person operations to a virtual setting. However, we've seen organizations respond with shifting their business model, adapting their programs to focus on pandemic impacts within the community, and in some cases, suspending some core services due to the overall risk of the virus transmission. Overall, nonprofit organizations have been extremely challenged this past year, and I'll be reviewing how we can continue to move forward in the next stage of the pandemic.
Thanks so much, Lilli. Really appreciate your commentary there, and it's always great to hear what our clients are facing and how they're pivoting to adjust. Isaac, I'm going to turn this over to you, and if you could talk a little bit about some of the things both before and after a loss that an organization should be thinking about.
Yeah, and this is really foundational in the conversation that we'll have through the rest of this talk, which is around proactive activities versus reactive activities. And when we're talking about being resilient and building a more resilient organization, we're advocating for clients to put as much time and energy as they can into proactive planning, prevention initiatives so that they're able to respond in the event of some kind of disruptive emergency event. And so what you're looking at in this image is a timeline. And as you move across this left to right, we're advocating for clients to put as much time and energy as they can into the left of loss side of this timeline, because when you are in response mode or you are in crisis management mode or recovery mode, that's going to be much more expensive, it's going to be much more disruptive. And the more you can do on the proactive side, the more likely you are to minimize losses, disruptions, and even in worst case scenarios, human life. And so that left of loss mindset is what guides us and what we're encouraging clients of all sizes, large or small, to really think about strategically and plan for.
Thanks so much. I think that really helps to set the stage for today's discussion. So Lilli, here we are over a year later into this pandemic. I'm hoping you could provide us with a bit of an update on where we're at and some of the things that nonprofits should consider when managing this risk.
Absolutely. Very quickly, we have all adapted to utilizing the following terms in our daily discussions, such as pandemic, self-isolation, quarantine, social distancing, screening, and Zoom meetings. Let's dive into how organizations are operating in this new normal and how they can improve some of their risk management practices. Here we are, 1 year later into the pandemic, where the cases have progressed across Canada. I would like to provide a comparison from last year on April 21st, 2020, with 36,831 cases of COVID-19, to where we are now as of yesterday's case count of 1,144,902 cases. This map of Canada and case count numbers are referenced on the slide, and it really helps us to track the total number of cases by province. What is significantly different from a year ago is we are currently in a third wave, and we're seeing an increased outbreak of transmissible variants of concern, VOCs, across the provinces. However, on an extremely positive note, just 1 year later, we are also seeing the Canadian vaccine campaign active, and we are in the midst of rolling out a countrywide vaccination program. What still remains is we are still battling a global pandemic, and we are still faced with the same challenges ongoing with rapid changes to public health guidelines, provincial lockdowns, travel restrictions, and the continued efforts with ensuring organizations are focused on reducing the transmission of the virus in the workplace and community settings. We are finally at the stage of a Canadian-wide vaccine rollout. Currently, we are right at a critical crossroads with the race against the virus and the variants of concern against the timely distribution of our vaccination program. The important factors that come into play that can be seen as roadblocks are pandemic fatigue with the constant back and forth with restrictions and lockdowns, the availability and supply of vaccines within our regions, and proper vaccine education on the health and safety measures around the vaccine rollout. As emphasized by our Canadian Public Health Agency of Canada, it is a responsibility of organizations to reinforce public health guidelines on the facts about the COVID-19 vaccines and what you need to know about getting the vaccines in your local regions. Every day, we are seeing reports from our public health authority on the direct results of our cumulative efforts with adhering to lockdown measures, limiting the mobility of people, and providing access to vaccines. I do remain very positive with seeing the rapid increase in the number of Canadians being vaccinated. As of yesterday, April 21st, there were 10,798,150 doses administered. This is according to the Canadian COVID-19 Tracker website. In the coming weeks and months, I'm anxiously waiting to see the numbers change and be reversed, with a greater number of people vaccinated versus a lower number of COVID-19 cases within our communities. I encourage organizations to validate and make sure the correct vaccine facts, resources, and information shared is from our Canadian Public Health Agency and local public health authorities. We are all in this together with reducing virus transmission and keeping ourselves and others healthy and safe. An organization's risk management approach to the pandemic can be broken out into steps, highlighted in this diagram. Each step helps to prioritize an organization's process to ensuring regulatory compliance measures are being met and the risk of exposure is mitigated. Monitoring the outbreak response in your region is essential. I don't think we can escape not knowing where we are at with the number of cases there are, what restrictions are in place, and who is eligible for the vaccine. Nonprofits need to be fully engaged and aware of the applicable public health measures that apply. Reviewing public health directives are key to ensure any new mandates or updates regarding essential or non-essential operations, new employee and public screening measures, and any specific self-isolating protocols are just a few examples of what nonprofits need to be aware of. By not keeping informed of any changes to public health directives can cause a significant impact to your organization, with the potential for regulatory violations, penalties, or even a shutdown of operations. The health and safety and wellness of your employees should be a priority as they are valued staff within your organization. By keeping your services and programming operational, implementing these occupational health and safety measures, and abiding by these strict screening guidelines and safe work practices are important for everyone. The safety and health of employees is not only regulatory, but is also the organization's responsibility and duty to provide a safe workplace for everyone. Lastly, continuous education and enforcement is what sustains a nonprofit's culture to focus on safety, health, and risk management. Everyone has a responsibility to lead by example with complying with public health measures and safety procedures. Having in place a risk management approach to the pandemic is what reduces the direct and indirect impact it may have on a nonprofit organization. Here we have an analogy of an iceberg where if risk management practices were poorly implemented, the direct impact would be the tip of the iceberg, which is the part you see above the water. And some examples of this would be an outbreak, community transmission directly related to the nonprofit, sick employees and members of the community, decreased funding, and a potential shutdown of operations. The other end of the iceberg is hidden underneath the water and represents the indirect impact to an organization. These examples are usually less recognizable and indirect, such as negative publicity, impact to branding reputation, reduced staffing, services restricted, a reduction in operations, and potential damage or weakened relationships to donors and sponsors. Overall, direct impact outcomes are typically the short-term immediate consequences without having a risk management approach to the pandemic. And the indirect impact can have a significant effect on your organization, but more long-term effects as they are not as immediate.
Thanks so much, Lilli. I think that really helps to illustrate just how much impact there has been to nonprofit organizations. What should the strategy or approach be for a nonprofit when they're implementing safety plans?
Thanks, Stephanie. To recap, I've reviewed the importance of a risk management approach in response to the pandemic, and now I'll be talking about what nonprofits specifically need to do to implement safety and risk management practices. Nonprofit organizations need to focus on public health guidelines, infection prevention and control measures, all with the intent on reducing the transmission of COVID-19. We are all now familiar with the protective COVID-19 measures in place since the start of the pandemic, and I'll be going into the specifics around developing and implementing a COVID-19 safety plan and conducting an ongoing assessment of the services and programs offered. A COVID-19 safety plan is a specific workplace prevention plan that is legislated by occupational health and safety regulations across Canada. A COVID-19 safety plan addresses how the workplace will follow public health protocols into their everyday operations. The plan should continue to outline the nonprofit's policies and procedures they have put in place to reduce the risk of COVID-19 transmission. Here is a listing of some specific protocols that are part of a COVID-19 safety plan. Limiting people interaction. This could involve requiring employees to work remotely. In-person interactions should be reduced, and where possible, operate in a virtual or remote setting to provide client services. Reduced risk of exposure. The focus here would be employee and public screening of symptoms to make sure those with symptoms or exposed to a positive COVID-19 case are restricted from entering your organization or participating in services delivered. A nonprofit should have policies around self-isolation, flexible scheduling, or remote work options. Modify physical distancing. This is where an inspection or risk assessment can be completed to determine people capacity limits for a location, rearranging furniture, and redesigning workspaces to allow for physical distancing. The use of barriers, floor or wall markings, and signage are needed to direct and remind people where they are safe to be. Masks and PPE. A mask policy is needed for all employees and the community to wear masks while inside a public setting and when it is unable to maintain proper 6 feet distance. Training should be conducted for staff on how to don and doff a face mask, face shield, or any additional personal protective equipment that may apply. Enforcement of mask wearing by employees and by everyone in a public setting is what needs to be monitored and emphasized. Additional policies and procedures to consider for a COVID-19 safety plan are fresh air, looking at creating any opportunity for additional airflow and increased ventilation can improve air circulation and reduce the airborne transmission of the virus. Any opportunities with checking HVAC systems, elevating fresh air through windows and the outside are additional measures to consider. Cleaning and disinfection are protocols that have been attentive to all of us since the start of the pandemic. For those nonprofits who have yet to resume in-person work and in-person services, this will be a new procedure to identify areas that are high-touch surfaces and common areas such as counters, railings, tables, and door handles. Communicating these safety policies and procedures is fundamental to ensure anyone working or entering the organization's facility should understand the policies to be followed to keep themselves safe and to reduce the spread of COVID-19. Meetings with staff, bulletins, signage, and emphasis on the importance to follow the COVID-19 safety plan makes it everyone's responsibility. The collection and reporting of data is a strong recommendation from public health authorities in the event there is an outbreak, and attendance records can help with determining the potential spread of the virus. It is very important to note that the tracking of information is voluntary, and the primary goal, like every other policy in the COVID-19 safety plan, is to prevent the spread of COVID-19 in the workplace and community. Collectively, these policies and procedures are a nonprofit's COVID-19 safety plan. Together, they provide a comprehensive approach to safety and risk management. The pandemic has evolved many times since the start, and we have seen so many changes and updates to public health guidelines. It has also required the need for nonprofits and organizations to continually do a risk assessment of their ongoing services and programs. Here are a few areas where nonprofits need to monitor and assess. One thing I haven't stressed enough is ensuring organizations are clearly informed of current provincial health orders that have specific timelines and requirements to follow. Looking after buildings, facilities, and office space, and ensuring they are secure with periodic inspections, monitoring, and security measures, especially if the locations are vacant with staff working remotely. As mentioned, the safety and health and well-being of employees are so important to keep in touch and monitor anyone working remotely and/or offering work from home options such as a hybrid work week or flexibility. Resources and technology have been what most organizations have been relying on, with almost all or part of their services being shifted to an online platform or virtual setting. There has been some great platforms that are widely used, such as Google Meets, Zoom, Microsoft Teams, Google Hangouts, and of course, GoToWebinars, to name a few. As technology continues to evolve, we will certainly continue to integrate these platforms to existing in-person activities. As we start to see cases go down, more people getting vaccinated, we will then see lockdown restrictions lifted. However, in the meantime, nonprofits should be focused on what activities and services they can continue to offer in a virtual setting, hybrid setup, and of course, when we can safely resume in-person activities. Nonprofits may already be functioning in a limited capacity, and the ongoing assessment is important to plan for future restart of services in a safe manner. A part of assessing current operations and services is the scheduling of appointments or registrations that can help with limiting the number of people in a location and maintains a level of attendance tracking. By doing so, staggered time slots and appointments can help structure physical distancing and not maxing out on capacity limits to a particular space. Depending on what nonprofit services are offered, consider putting together cohort groups or dedicated staffing to really help with limiting the spread of the virus and maintaining consistent groups of individuals together. Lastly, as we begin opening up and resuming in-person operations, any equipment, furniture, or items that are used requires cleaning and disinfecting. Options can be considered for single use or dedicated materials assigned. As a whole, any effort made by nonprofit organizations to reduce the risk of exposure and spread of COVID-19, and any emphasis looking out for the safety and health of employees and the public, are steps forward with lowering risk and exposure for everyone.
Thanks very much, Lilli. There certainly is a lot for nonprofits to consider in the response to this changing world. Isaac, looking longer term, we hear a lot about resilience and business continuity. Could you walk us through what exactly that means and why organizations should make it a priority?
Yeah, and as we talk about building a resilient organization, I just want to lead with and emphasize that the things we're going to talk about here are intended to be built for purpose and tailored to the size, the geography, head count, and to your mission. So as this can get a little technical, we want to emphasize that whether you're an organization with 10 staff and seasonal volunteers, or if you're a very large organization, these strategies and this approach is intended to account for that. So when we talk about organizational resilience, what you're seeing in this image is a cyclical process. And essentially, when we talk about resilience, we're talking about building the capabilities as an organization to anticipate and prepare for incremental change or sudden disruption. And so we all got a crash course in this during COVID-19. And as we've learned, it's an ongoing, ever-changing issue and disruptive event that we continue to reassess almost daily and implement changes around. And so what we hope to, the seed we hope to plant here is that leveraging lessons we've learned through the management of the very disruptive pandemic can help us be stronger as we move forward and be more prepared for other types of disruptions, which, as we all know, are ever increasing with things like climate change and increased wildfire season durations, or I guess on the other side of the continent, we have concerns around hurricanes or flooding and winter storms. So there's really all kinds of issues that are at play here. When we talk about being resilient, we're anticipating all of those hazards and trying to understand how they might impact us so we can be more prepared. So a common question that I get as a consultant in this space is, why should I take on this proactive initiative now? We just lived through the most disruptive global event that has probably ever happened in our lifetimes, and hopefully ever will happen in our lifetimes. And so part of why we're still emphasizing the importance of leveraging these lessons we've learned and formalizing some of these plans is because as a result of the pandemic, we're seeing an uptick in reasons to prioritize crisis management planning, crisis management team development, and business continuity plans. And so some of the things on this list here, legal and regulatory compliance is of course important, and it's ever evolving, depends on what industry or space you're in or who you're serving. Partnership requirements are evolving, so we're seeing business partners request formal proof of crisis plans, of continuity plans. So there may be spaces where people come to you and say, we're excited, enthusiastic to be partnering with you. We really believe in and support your mission. We'd like to be able to see and understand what your plan is for managing a crisis or being resilient through disruptions. That's important to us. Can you prove that you have these capabilities? And then maximizing insurance coverage is becoming more and more relevant when you talk about insurance coverages like business interruption type coverages. There's again going to be more burden on the insured to show that they have preparedness plans in place, that they have exercised those plans, and that it's more than just a paper document. And then finally, and maybe most importantly in the nonprofit space, is reputation management. And you've probably seen examples in the news media where something relatively minor happens, in the way that that organization manages it, speaks to it in the news media or on social media, actually makes the situation much worse. And that can cause that snowball effect, which puts you in a much worse position than had you had a more formal process in place to manage those things. So the big response to that question, why bother now? It's very situational, and you have to make the decisions about how much planning you want to do, how many resources you want to allocate toward that. But there's only going to be an increasing burden on organizations to position themselves and essentially make their security, their risk management, and their preparedness posture stronger. So there are elements, and a common question we get is, what is all involved in a business continuity management initiative, and what is it? And we always want to emphasize that there are multiple components, that there's a lot of overlap in various parts of preparedness initiatives. And what we're looking at here are just 4 buckets that are the most common elements that are integrated when we're talking about a continuity management approach. And so emergency response on the left is essentially protecting people and property. And so the emergency response phase is things you're already familiar with. This is things like fire drills or sheltering in a storm, or preparedness around a potential act of violence occurring in a space that you occupy or on your property. And so the emergency response element is often more about protecting life and property as opposed to operational concerns and considerations. When you move into the crisis management phase or elements, we're talking more about protecting the organization and your operations and your brand and your reputation. IT operations recovery is ever present now and kind of lays over the top of all of this. But as we're all well aware, something as simple as loss of internet connectivity can more or less paralyze organizations, whether big or small, especially in the COVID environment where we're heavily reliant on technology. And so that can run the gamut all the way to something as serious as a ransomware attack or some kind of cyber risk management issue that is unmanaged and could potentially significantly impact you, all the way to the personal identifiable information of donors or of clients that you serve being compromised. So incorporating and thinking about IT resiliency is equally important and part of this continuity conversation. And then business continuity planning sits over the top of all of these things and is really about protecting business critical processes and functions that allow you to continue to deliver services to clients or to continue to serve your community and move your mission forward. So those four things combined essentially put together what is a business continuity management initiative. So we also want to frame this in terms of where this falls on a timeline. And so as I talked about, emergency response is more about protecting people, protecting life, protecting property. And so this is, for example's sake, going to be in the minutes to hours. And if we're using, let's say, a fire event for an example, this is when the fire alarm has been pulled, the fire service has arrived, they're there to contain and control the emergency. And the goal is to protect property, make sure it doesn't spread, make sure it doesn't impact others in the area. They're stabilizing it. That's the emergency response, and that's going to be in the minutes to hours typically. Crisis management plans kick in the hours to days following a major event. So let's, in context, in the nonprofit space, what we find that's unique and interesting is there oftentimes aren't a lot of facilities or physical property or product that's involved. So the emergency response phase might be very small, or it might not exist if you have a staff that's mostly working remote, or you have a single leased office space and people are more or less out in the field or out in the community doing work. The crisis management phase may be more of your emergency when we're talking about potential damage to brand or to reputation. So the crisis management plans are typically going to be in the hours to days after the disruptive event. And what we hope to see here and help clients build and establish are pre-existing plans for a crisis management team. And if you're very small, that might be 2 or 3 critical stakeholders, executive director types, and then a whole team of vendor support. So you might not have the internal capabilities for external crisis communications. Maybe you have a firm on speed dial to support that, but that would be included in a crisis management plan. You would probably also have legal counsel, and you would probably also have consultants that would be liaisons to media, to donors, to critical stakeholders. All of this stuff in a coordinated plan that pre-exists, that you've exercised, is going to make you much more prepared and much more resilient when something disruptive and impactful occurs. And so then the continuity plans and the IT operation recovery plans typically would then follow in the days to weeks when you've protected human life, when your crisis management team has stood up and said, we need to manage this more strategically. Then you're talking about, in the days and weeks to come, how do we continue to deliver services? How do we continue to meet business or organization critical activities so that it's as minimally disruptive as possible? And so, like we talked about, we've all kind of learned, whether you were prepared or not, when COVID disrupted, all the things Lilli covered, we kind of had to learn on the fly and implement in real time. And that is obviously far more complicated and more difficult if you're not prepared in advance of that. So for context, when we talk to organizations about planning, oftentimes it's overwhelming because there are obviously a lot of different hazards that could potentially impact an organization. So where do you even start thinking about what would be in a recovery plan or in a crisis response plan? And one nice way to start to think about this or bucket it is around the type of disruptive scenario. So what you're looking at here are examples that specifically speak to what would the impact be if we lost access to our physical facilities, to our office space. What if we lost critical staff? This could include mass absenteeism, like we've had a COVID outbreak in our facility. We've lost, all of our critical staff is now quarantining. Maybe someone's hospitalized. When you lose staff, that's obviously equally disruptive. So what would a plan look and feel like to have workarounds for loss of staff? Or someone could just leave. You could have someone resign or take a new role. And if they take a lot of institutional knowledge with them, that can obviously be quite disruptive to an organization. Loss of technology we spoke about. This is really in the space of tools and resources that you're using that are web-based or software as service type things, or even connectivity. Something as simple as the loss of a laptop. If you have your laptop stolen and you are an executive director type with a lot of responsibility that lives with that technology, that simple loss could be disruptive. Probably not crisis level disruptive, but it really just depends. And so finally, we think and talk about loss of a major donor or loss of a major relationship that would significantly impact your ability to operate. So when we think about response planning by scenario type, it gets easier to start to segment and assess and inventory how you might respond if you've had a loss of critical staff, loss of that facility, or one of these other scenarios. So part of this is what's called a business impact analysis, and this is where we get a little bit in the weeds and a little technical. But what I'm showing you here is a screenshot of a worksheet, and the purpose in showing this and talking about it is that there are a lot of structured tools that exist in the marketplace, either through potentially through vendors or through professional associations that can help guide you and get you started. And this is basically a worksheet, and you can see here it's asking about department name, department owner, the director of manager, and then what products or services are directly or indirectly delivered by this department. And so this is where you start to document and inventory the critical functions that different teams or different people deliver, and what would the disruptions be if those were lost. And then additionally, what are some potential workarounds for this? And so I show you this to emphasize that there are tools that can get you started and that you can use in a structured way. So we're not having to improvise or make this up as you go. There are a lot of really good tools and resources that already exist to start you down this path. And once you've done this, once you've spent the time to do the impact analysis, the output of that is going to be recovery plans. And this is essentially your playbook. And so what we're looking at is a human resources example. So if you did that BIA with human resources as the department, once you have all those things inventoried and you can talk about the critical things that HR delivers, you can then start to plan a recovery strategy for human resources in all of those different scenarios. So if you've lost a facility, how would that impact HR's ability to deliver services? If you've lost critical HR staff, how would that impact them? If they've lost a key tool or technology that they need to do their job to deliver those services, what would the workarounds be? And then lastly, how would a large loss of a donor relationship potentially impact different departments or different functions? And so those are just two examples to show you that there's a worksheet and that drives and informs what a recovery plan would look and feel like. And then these are the tools that you would use as a crisis management team to start to take a structured response approach in the event that you've had a major disruption. Another great tool is a basic risk matrix, and you've probably seen this before, but essentially what we're doing is inventorying hazards that are likely to impact us as an organization, and then laying them across this risk matrix to determine where we spend our time and energies. And so, for example, if we were to put loss of a major donor relationship into this table, if that could impact you in a way that is intolerable or potentially catastrophic, that's something we would really want to spend time and energy planning for. Or loss of critical staff or facility. Obviously, those things that are more likely to impact us are things that we would want to spend more time and energy anticipating and preparing to work through in the event that it happens. On the acceptable side of this, extremely unlikely to occur, crossing paths with the insignificant impact, well, those things may occur. If it's not enormously disruptive, then these plans probably shouldn't focus in that space. So an example here would be a natural disaster that would never impact you. If your operations are on the West Coast, you're concerned about catastrophic wildfire outcomes. You're not worried at all about a hurricane. So you wouldn't even put that on your risk matrix. So that's just an example of another tool that can help us categorize and assess where risks and hazards might impact. Additionally, Lilli and I didn't sit down and make all of these things up this morning. There's a large body of knowledge that exists, and national standard documents and guidelines that can help and support in your pursuit of resilience. And so these are a few examples that can easily be looked up and acquired online. And these are international standards that really guide best practices in some of the spaces that we've talked about. So if you want to move down this path, certainly we're here to support and help and guide, but additionally, there's source material that can get you down the same path.
Thanks so much, Isaac. That was a really great overview and some good guidance on how an organization can approach the implementation of a solid recovery plan. And I think a very good segue leading us into the final topic of today's discussion, which is insurance. Given that each organization is different, there is no one size fits all when it comes to creating an effective insurance strategy. But there are a few things I would like to highlight that apply to all organizations. The first being strategy first, insurance last. Commercial insurance should be the court of last resort in any holistic risk management plan. It's a way to pay for bad things when they happen. As insurance brokers, when we submit a risk to a company for a quotation, one of the first questions we are asked is, what type of risk management plan does this client have in place? Being able to demonstrate that you have a solid plan means you're operating as a best-in-class organization. When insurance companies recognize and understand this, it really goes a long way to ensure that you are getting the best possible terms, including comprehensive coverage and competitive pricing. And secondly, I would recommend that organizations look off the beaten path. Opportunity for claims exists everywhere. Most organizations do think about the traditional subjects of insurance, such as property damage resulting from a fire, or liability arising from a slip and fall on your premises. However, insurance product design has come a long way over the past few years to really keep up with evolving risks and exposures that aren't always addressed by plain vanilla type insurance. Some of the risks that are often excluded or limited by traditional policies include professional liability, and this insures against liability for acts, errors, or omissions in the rendering of or failure to render professional services. Professional services are generally held to be services that require advanced credentials such as law, accounting, medicine, counseling, and consulting. Just to give an example, so the family of a disabled woman claims that the residential facility responsible for her care failed to recognize and arrange treatment for a serious illness. Cover for this exposure can be added with a separate professional liability policy or by endorsement at an additional cost. Abuse liability, which is liability arising from actual or alleged abuse. Most organizations serving vulnerable populations, their general liability policy will typically exclude or limit this coverage. Protection must either be restored by endorsement or arranged on a separate policy. And also worth noting here is that in order to obtain this coverage, insurance companies do have strict underwriting rules in place to ensure that the organization has adequate abuse protocols and procedures in place. Cyber risk, coverage for loss associated with network breaches, damage to computer networks and digital assets, or the unauthorized release of personally identifiable information. Personally identifiable information includes any recorded information about an individual, including race, nationality, religion, age, marital status, education, medical, criminal, or employment history of an individual, or information about financial transactions. These losses have certainly become prevalent over the past few years, and with more people working remotely and online, there's an even greater risk of cyber scams and data breaches. Traditional insurance policies tend to provide only partial, fragmented coverage for such incidents, leaving big gaps that are best filled by freestanding cyber policies. And just to give an example here, a nonprofit fundraising executive leaves his laptop in the car, which is later stolen. The hard drive contains personally identifiable information for thousands of donors. As this would be a data breach, the nonprofit would incur substantial expenses to engage with Privacy Council, conduct forensic investigations, notify potentially affected parties, provide credit monitoring, and engage with public relations consultants. These costs and resources can really add up, so it's best to have a policy in place to provide protection. Media liability provides coverage for personal injury and intellectual property infringement arising from oral, printed, broadcast, electronic, and internet content, including social media. For example, a photographer claims that an organization used his work on its website without permission or compensation and is now seeking monetary damages and injunctive relief. The best solution for this exposure is media liability insurance, which is now commonly packaged with cyber coverage. And finally, just wanted to mention international risks. Domestic insurance policies generally respond only to claims brought in Canada and the US, leaving any global business operations exposed for claims brought abroad. A potential solution here would be an international package policy, which can be built to address these risks occurring off Canadian soil. And just a quick example, a board member traveling abroad draws a bath in her hotel room while waiting to join a conference call, forgetting that the water's running. The tub overflows, it causes significant damage to her hotel room as well as the 2 rooms below. As I said earlier, no two organizations are quite alike, so working with a skilled risk advisor and insurance broker can help you to identify the risks and insurance needs that are specific to your organization. And I would also recommend communicating with your broker if your operations have changed significantly. For example, if you've had to pivot from in-person fundraising events to virtual, it's important your insurance company is aware of any changes so that your operations are not misrepresented and you have the right coverage in place to meet your new needs. There are a lot of tools and resources available to support you in building your risk management and insurance plans. Along with the recording of this session, we will be providing you with some of these useful tools, resources, including a link to Hub's Coronavirus Resource Center and a link to register for Hub's virtual summit in May. And with that, I believe we may have a few minutes left for some questions, so I'm going to turn it back over to Marina.
That's great, Stephanie. Thank you so much. We do have some questions, so I think we will just dive right in here. So our first question is for Lilli. The question is, we currently don't have a COVID-19 safety plan, and we don't have a lot of experience developing written policies. Where should we start?
Thanks, Marina. Yeah, it's a great question. There's just so much required and so much needed for organizations to do during this time. And what's really helpful is each province has their own occupational health and safety authority and regulatory bodies that have put together online links and resources on developing and putting together policies and procedures to really implement a COVID-19 safety plan. So I would suggest you the person who asked the question to really dive into your local regional occupational health and safety website and look at the resources there, and that would be a great launching pad for you to at a minimum complete the forms, the guidance there, and really help you to customize the operations and services that are applicable to what you're doing. As well, Hub is we're also here to help with our risk management expertise and consulting as well.
That's great, Lilli, and I see the contact information is there on the slide deck. So yes, if you do have questions about that, or if there are questions that we don't answer in today's Q&A, please do reach out directly to Hub. Stephanie, I think this one is going to go to you, but I'll open it up to the panel if they have comments. We have a question from Lisa. I'd be interested in the panel's comments about rising insurance costs. I have heard scary stories about significant premium increases faced by nonprofits this year.
Thanks, and yeah, that is a great question, and there is a lot going on, especially with rising insurance costs. And it's my opinion that we haven't yet realized the full impact of COVID on insurance rates. So what we're seeing now is being really heavily driven by market conditions. And as you know, all industries experience cycles of expansion and contraction, and this is really true of the insurance industry, and they're referred to as hard and soft markets. So soft markets, so you lower premiums, broader coverage, relaxed underwriting, increased capacity, more competition amongst carriers. And on the other hand, a hard market, which can be characterized with rising insurance premiums, more stringent underwriting, reduced capacity, and less competition. And I would say pre-COVID, we were certainly in a hard market, and we continue to be there, but I hope we're moving towards a transitional market. So I think it is a fair expectation to say that we may continue to see increased rates. For the nonprofit sector, we're seeing rate increases around 10 to 25% range. As a broker, it's our job to always advocate for our clients, and we really do our best to work with insurance companies to help mitigate those increases where possible. And additionally, we have seen some relief coming from insurance companies. You may have seen this personally on your personal auto, some rebates and rate relief coming there. And we're starting to see insurance companies do more in the smaller business space. So hope to see that continue into the future.
Thank you, Stephanie. I'm going to send this one over to Isaac. We're a small organization. We have less than 10 employees. Do you have any special advice for the crisis and continuity planning that you talked about today?
Yeah, that's a great question. We kind of touched on that a bit with the conversation about having a crisis management plan that pre-identifies resources that you might leverage in the midst of a crisis event. And so having like a crisis communications firm identified and vetted and on hand as part of your plan can help you account for things that you might not have subject matter expertise around internally. And similarly, having people lined up for things like cyber risk management or incident support, or really a number of other things, even including things like having a security firm pre-identified. If you have some kind of disruptive event that requires you to have an increased physical security posture, having a firm pre-identified, vetted with a point of contact to quickly get potentially security guards on site. All of those things typically make it easier for small organizations because you only have so much bandwidth if you have a smaller headcount. And often the disruptive events impact people. So if wildfire season is, tearing through a community, you have work considerations, but all of your employees also have their home life to consider and to manage. And sometimes that's going to trump their willingness or their ability to support the organization in crisis. So the smaller you are, the more important it is to have great resources outside that you can leverage.
Great. And I think this one will go to Lilli. How important is it that safety measures regarding COVID are documented? And I think the person asking the question is probably talking about having written documentation, especially in terms of liability.
Documentation is key. It's a great question, and you know, the part of having occupational health and safety management systems in place, looking at insurance, making sure that, you know, procedures and policies are documented but also implemented is key. So documentation on all levels is important. And that's one thing that's lacking in terms of organizations and nonprofits is actually spending the time to focus in on, you know, the written procedures. It doesn't need to be lengthy. It doesn't need to be, you know, a big manual sitting on a bookshelf. What's meaningful is making sure that whatever is relevant and applicable to your operations and your organization is documented. But also it's implemented. So in terms of the liability, it's extremely important that, you know, in the event of a serious event, whether it's an outbreak, whether it's you know, a fire or a significant threat to the organization or your operations, there will need to be proof of documentation that, you know, this is our policies, this is our commitment, these are the procedures in place to really mitigate, address, and also document all the efforts made by the organization. So documentation is truly important.
Great, and I'll let anybody jump in on this one. Are there any special considerations for a volunteer-driven charity that doesn't have staff? Or would you say that most of what you've talked about today is still applicable?
I would jump in. I say, well, most of what we talked about today is applicable, and speaking to an insurance policy, generally volunteers are treated the same as an employee under the liability policy. From my perspective, it would be applicable whether it's volunteers or employees.
Likewise, from an operational COVID-19 safety plan, volunteers are treated as employees and staff and vendors and contractors and clients. It's really all encompassing.
Fantastic.
Well said.
Oh, that's great. Well, I'm looking at the time. I think we're going to cap questions there. So Lilli, Isaac, Stephanie, just wanted to thank you again so much for such a great presentation. Really appreciated having you here with us today. I want to just remind everyone before we sign off that we will be sending the full video recording and the slide deck to everyone later this afternoon by email. Please do feel free to share that link with your colleagues. The recording is publicly available, so anyone can view it. The emails will also include a survey link where you can fill out, you know, give us your feedback on today's webinar, as well as indicate if you would like to receive any additional resources from Hub. On behalf of Charity Village, thank you again for joining today. Our next free webinar is coming up on May 6th. We're going to be covering the ins and outs of reference and background checking for staff and volunteers. And we will also provide a sneak peek at our new screening services that are going to be launching soon. So there will be a link to register for that in the email that you get later today. So thank you again, everyone, for taking part in today's webinar. Thank you to all of our panelists, and I wish you all a wonderful rest of your day. Bye-bye.